Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hi, everybody. Welcome to this week's Holistic Nurse with Peggy Smith. I came across an article this week about chronic pain that I think would be of interest to the viewers. Is almost everybody at some point in their life, and sometimes most of their life, deal with pain issues. And from a nurse's perspective, when we're being educated, we consider pain, they describe it as the fifth vital sign. You've got your pulse, your blood pressure, your heart rate, respirations. And for a long time in medicine, we probably didn't give the attention to pain complaints as much as they deserved. But medical personnel in traditional medicine do take your complaints and your descriptions of pain very seriously, because 1 in 5 adults in the US report chronic pain. And that's about 52 million people at the last count, which is more patients, more consumers than are diabetics or suffering from depression. And coincidentally, if you have other comorbidities, you often are depressed, because it's hard to be happy in your usual self when you're suffering with pain. Today, I've got Dr. Gloria Warren with us, and she's going to be, she's a medical intuitive, has a lot of pain treating experience also. And together we'll be sharing some holistic techniques that you can do to make your pain management manageable, and both to your budget and to your physical or your psyche. Welcome, Gloria. It's great to have you today.
Hi, thank you for having me here.
So, back to the statistics, chronic pain is by definition something that doesn't seem to ever go away. Even if it, for some reason, is short term for maybe a surgery that has a long recovery, or, other type of a new diagnosis. And chronic pain is not always just physical pain. We'll be touching on some of that. If you get a diagnosis that's very scary and frightening, and, kind of knocks you off balance a little bit, fear, gives you that sensation of pain too, but it's just as real as the physical pain that a physical ailment might be causing. Recently, AARP newsletter had a very interesting article from Sanjay Gupta. He is a well-known American medical reporter, specialist in, he's a neurosurgeon, specialist in Alzheimer's treatments. And he offered many very practical techniques and ways of managing pain in a recent book, among his many books that are bestsellers on Amazon and the New York Times. And the one that we're going to be kind of referring to as a reference, and it's inexpensive, it's accessible to everybody. It doesn't have to hurt. Along with that book, to make it, this is a smart guide for pain-free life, according to the doctor. He knows that, we got to keep it simple, or people just aren't going to follow through. So he's also got a step-by-step cookbook, including the shopping list, practical things that are not expensive. I'm trying to get on your screen here. Okay, my right and left are off. It doesn't have to hurt cookbook. And it talks about, it's 365 days of recipes, actually, as a guide for anti-inflammatory living and pain-free eating. Many times, even if we don't want to admit it, if we've eaten something that, maybe is on the naughty list, with lots of sugar, we have physical consequences for doing that. It might have tasted good and, it was our dream dessert, but it's either going to make you tired a half hour after you eat it for chemical reasons, or, it just causes your arthritis, your psoriasis, all kinds of complications. That guideline and cookbook is very helpful. And along with, not everybody, surgery is not an option for your chronic pain issues. but he also included an exercise guide that are very simple that everyday people that even sit in the chair or lay in bed a lot can do. And why don't you talk a little bit, Gloria, about why it's important for us to be empowered to manage our pain, because lately a lot
Yeah.
of people are feeling like they're victims of the healthcare system and they don't know where to turn.
Yeah, there. I think I'm an epidemiologist. I don't know if we mentioned it, but I see pain in today's is more of an epidemic because pain in itself has exploded due to the opioid pandemic. And now we're kind of curbing some of the opioids, but a lot of people, their pain seems to be exacerbated because the brain only has so much it can produce, and the opioids hinder the natural production of your endorphins and other types of hormones. So it also hinders the uptake. I mean, the uptake is hindered by opioids, so that you end up with more of these endorphins trapped. I believe it's the D2 receptor. You end up trapped in the brain where it cannot, it makes you feel happier longer. But now when you take away all the opioids and all the people that are addicted to these type of drugs, they, you take it away and then their body's not producing it as its normal level anymore. It actually hinders your natural production over time. So I call it the trough level. In pharmaceuticals, they have a different name for it, but it makes you feel pain at a higher level. So if you look at some of the natural causes of pain, um, let's see, I have a little list here, which is wonderful.
Mhm.
So I love this list of causes. And in this case, there's many causes of pain. It could be injury, trauma, um, surgery, recovering from surgery, they mean, that type of thing. Swelling, inflammation caused from arthritis, autoimmune disorders, infections, overuse, injuries. And then there's neuropathic pain, nerve compression, diabetes, shingles, things like that. There's musculoskeletal disorders, back pain, and I'm sure many of us have suffered from that at some point. Visceral pain is internal organs, kidney stones, gallbladder stones, pancreatic disorders. I know patients with a lot of pain with that condition. Cancer, of course, and psychosomatic stress-related pain. But, there are so many different things that can be done for all of these. And I just, there's natural things that can be done. And I was looking at that article that you were talking about, Nurse Peggy. And it is exactly, it's such a good article. If you haven't gotten that article from AAR, please get it. Please read it, because they're right. The fight or flight, under stress, your body goes into fight or flight. And then when it's in fight or flight, it triggers more hormones, which can block pain. And that's why, like, when people are in a fight and they can get punched and everything else, they're not feeling a lot of that pain until after the fight, when they're not under the stress. So it does work. I know, like, if I'm in a lot of pain, my biggest thing is I try to get up and move around. I move around and then I stretch. And there's so many different things, from complementary alternative medicine, herbal medicine, different things that can help it. I mean, I'm sure we can go on and on, but many causes of pain, different ways that you can handle the pain, and that we'll probably get into as well. So, stay where you're at, because you're going to love the show.
Well,
Um,
one of the things also that exacerbates the pain is just generalized anxiety.
yes.
If there's a lot of things going in your life that feel like you don't have control over, uh, you're anxious, you're tense, because you're tense. You're not getting that relaxation response to look at things with a clear head.
Yep.
It's like dominoes kind of fall, and a lot of people will often complain or at least report that pain is worse at nighttime. And maybe you can explain why that is for people.
Absolutely. At nighttime pain, it's nocturnal pain exacerbation. And the reason for that is when you're laying there sleeping, your brain is not occupied with things around you that you're seeing or hearing or touching. And when your brain is preoccupied, so you tend to not feel the pain as much. But when you're laying there in bed and you're not doing anything, the pain seems to feel a lot worse than it was when you were up. it feels more exacerbated because that's all you have to focus on while you're laying there. So, there are some things to deep meditation is a good thing. You can do the lay down meditation where you concentrate on just a toe and then just a foot, and you come up your leg and then you do the next one. And you can do meditation of various types while you're just laying there trying to go to sleep. But that seems to be one of the biggest problems I see in people when they have pain. It's always worse at night. Or in the hospital bed, it's worse too, because you have nothing to do but lay there and think of this pain. So you need to
Well,
get your mind.
one thing to bring up about the hospital bed, you don't get a lot of rest in the hospital. And as a night shift nurse for 40 years, I didn't realize how noisy we were at night until I was in the hospital at night. Like, God, how does anybody sleep here? And they don't, because the nurses are coming in, some of the aides are coming in, take your
Yeah.
vital signs. 3 o'clock in the morning, somebody wants your blood. And then they expect you to be bouncy, wide awake, and healthy to talk to the doctors and ask intelligent questions. And, you can't wait to
Mhm.
get home to get some sleep.
Right,
Um,
right.
and a lot of people have come, have offered the perspective and the complaint. They feel abandoned by their doctors because they can't access the pain medicine that they've been taking perhaps for years. If you have fibromyalgia, Lyme disease, different things like that, that's the way you were used to being treated, and it seemed to work, whether it was best working or not. It was there, it was available. And people have said, my doctors abandoned me. And I
Mhm.
want people to know that in our environment after the opioid crisis, because there was some abuse in that, a lot of abuse in that field, that
Mhm.
most doctors, your normal family doctor, they're not even allowed to prescribe the narcotics anymore.
Right.
There's a specialty now, pain management. Yes, it's hard to get an appointment. While you're waiting, these suggestions we're going to offer will help you manage, and maybe you won't even need that appointment down the road. But people have told me 3 or 4 months sometimes to see a pain management doctor. It's not
Yeah.
that they want you to suffer. It's that there are fewer doctors allowed to prescribe it. The monitoring from the federal perspective is so intense, and a doctor worked hard for his license. He doesn't want to accidentally make a mistake that would cause him to lose that license. But it has nothing to do with wanting you to suffer. And uh,
Mhm. It's the
you
rules and regulations over the physicians, and they're very limited with opioid prescriptions, very limited. I mean, if you do get one, usually it's 10 pills and that's it. If you're lucky, you know. So,
Well, if you know you're gonna need a knee replacement or a,
yeah.
rotator cuff, things like that, uh, I recommend, if it's safe for your doctor and your therapist and everything, try physical therapy first. I happen to be somebody that does not do well with anesthesia, so I'm gonna do everything I can to avoid anything except life necessary surgeries. But
Right.
I'm just amazed. I mean, I have a bad rotator cuff. I know my knees aren't going to be there in the capacity that they were 10 years ago. They're already starting to tell me that. And so exercise is a nice, inexpensive way. You don't even have to be with a physical therapist for some of it. And after our break, we're going to talk a little bit more about the holistic options that you have. We'll be right back.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to easysense.com and learn how, with your help, we can fight these horrific brain disorders. That's easysense.com to learn more and help support the Broderick Foundation. Author, Radio show host and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Hi, everybody. I'm with Dr. Gloria Warren, and we're discussing chronic pain and some holistic means of managing it that don't break your budget. You don't need your insurance card for it. Just little common sense and learning to listen to your body. Pain is real. It's not just something in your head. Maybe if you were a child that had child migraines, or I remember my mother telling me I was having growing pains. That's what our parents and grandparents our age, used to say, just growing pains. You'll grow and it'll be okay. And then you grew and they were like adult pains. Now you're old enough for arthritis, that kind of thing. But pain is real, and it's important that you do talk to your medical provider, because it's a symptom that your body's trying to tell you something is not right. Whether it's inflammation, whether it's doctors are tuned into listening to pain complaints now. As a child, I had my appendix out rather young. I had already entered puberty, and the doctors were trying to tell my parents at before 12 years old that perhaps I had, had some kind of inappropriate activity with an adult or something that was causing pain. It was my appendix. It almost burst before they listened to me, And so you got to listen to your children too when they're complaining of pain, and listen to yourself and the messages you give to vulnerable children. They emulate us, and they might get the incorrect impression that you feel like you're a victim of this pain, and you don't have to be. Managing our diet is something that we have control over. There's a lot of foods that are anti-inflammatory, a lot of herbs. Gloria, maybe would you like to talk about some of the herbs and spices that help in that area?
Yeah. When you were showing me that book, I was also thinking of Dr. Gundry. He has a lot of different videos out there, and he talks very, very much so about lectins causing swelling in your body and adding to pain. So when you said diet, that was the first person I thought of, and what he said about the lectins. And lectins cause swelling and inflammation, especially if there's an injured area. It makes it swell further. So that's any type of seeds, nuts, peels on certain things like tomatoes, potatoes. I mean, it's in a lot of your foods, but if you can remove them, then the swelling actually goes down, which is fantastic. But there's other things like in Ayurvedics you can do. Simple things, and I know you've heard them, but you probably forget. So my point is put them on a Post-it note, put them on your fridge, because these things work. Hot, cold, alternating hot and cold packs. Interesting. Raising the injured area or the part that hurts the most, raising it up above your heart. Put your feet up. Do something like that. Try it. It doesn't work all the time, but it does work quite a bit.
Well, one of the reasons that's helpful, Gloria, is because we talked about it in your show yesterday, how in the blood circulation, the blood is being purified and, back up to your heart. So if you're elevated to help the blood get back to your heart and get all areas, sometimes swelling is a matter of the blood is pooling and fluid is pooling in your feet or your legs, or a dependent appendage that maybe you wake up and you slept on your arm all day and, cut the circulation off for a couple hours. Those are all,
builds. Yeah.
The blood has to cleanse our whole circulatory system constantly.
Yes.
Getting enough water in our diets, and we've talked many times before. In our country, at least, it's not natural for us to drink as much water as we should be. Um,
Right.
you know,
Right.
it
So,
naturally cleanses.
yeah.
Um, the
A lot of the
the
times, though, the swelling
Good.
itself, is people need to realize it's a natural body's response to swell, and that pulls the serum, the clear liquid from your blood. That's where all your healing components are in your blood. So swelling is not always bad. However, if it's too much where you're not getting the circulation in there to keep everything so it's not, bacteria is not forming, that type of thing, you want to keep it under a certain limit. So it's all in a balance. You want to try and balance swelling with not having swelling. So when you're dealing with pain, you have to balance it, you know. But I mean, we have a lot of different things, non-drug therapies. Maybe we should look at that,
the
strengthening
red light,
muscle.
the light therapies are very helpful.
Oh,
They're
yeah.
not heat. You want to say a little bit about the light therapies and your
The light
experience with that?
therapies, I use it often, even on myself. And I like to use red light laser 650 to 665 nm because it kills all the bacteria through the ray, and it'll go in. And there's scientific study to prove all of this. It does three things. One, people can use it for wrinkles, not near their eyes though, never. So but they can use it for their wrinkles, they can use it for acne, and it also kills bacteria through the skin around up to 2 inches in, if not even more. And what it does now that they found is it reduces pain and can reduce swelling as well, because it increases circulation to the areas that have this pain, whether it's arthritis pain or an injury or post-surgical. Be careful though with red light laser post-surgical, because you want to make sure it's healed at least a week before you use it, because those blood vessels may have been cut during surgery and you don't want to have internal bleeding or in the skin or anything like that. So like there are certain guidelines. That's why people usually call and talk to me, because I can go through certain guidelines and direct them to the right people too, and let them know when they need to go see their medical professional, because sometimes they're just confused. I mean, there's so many things happening with our bodies nowadays in this world. So you just never know. And it's good to have a pool of people you can pull on their intelligence and get good advice, good solid advice from certified personnel, certified medical professionals, whether it be a doctor, a naturopath, even a chiropractor knows so much about pain. So pain in general is a very broad spectrum. However, getting it where it is alleviated may take medications. So do you want to talk about some of those medications perhaps?
Before that, when you were talking about the risk of the laser light, what came to mind is Reiki. Reiki is a technique,
Oh,
non-touching, and it's been described sometimes as a first aid kit in your pocket, because you can learn the
mhm.
techniques and do it for yourself. But there's one time that you would never do that. If you suspect you have a fracture, and you haven't seen a medical professional, x-ray or anything, you don't ever want to use Reiki techniques, because you could actually heal it quickly and heal it incorrectly. The fracture might be
Yeah,
misaligned. Um, and the red light kind of has that similar concern if it's healing something too quickly. Um,
right.
so there's always information, valid information, and professionals out there. In my hypnosis practice, I'm certified in medical pain management with hypnosis. And
Yeah.
what I actually do, though, is I'm not doing anything to the person who's having pain. I'm teaching self hypnosis skills. And that's something that anybody can learn. It's a combination of uh, the breathing techniques, relaxation, progressive relaxation. um, if for those that have had children, and you're in labor, you learn that breathing and relaxing helps you get through what, a man would describe as probably the worst time in our life.
Yeah.
We take it in stride. uh, you know, and and there's also oh, my mind just slipped for a minute here. There's acupuncture is something that obviously a professional has to do, but you can also be taught how to do reflexology and acupressure. For instance, there's a technique for really bad headaches. It's called TAPAS, TAPAS. And basically, if you have a horrible headache, and it's worked. I mean, I laughed when I saw how I wanted to prove it wrong. When I was first learning these techniques, I was doubting Thomas. I was determined to say, oh, you guys are all quacks. But a really bad migraine, and someone showed me the techniques. And these pressure points up here, and you just hold it, for a few seconds, maybe repeat it again a couple times. The headache goes away, and that didn't cost anything at all, and it's easy to remember to do. With your diet, there's so many things that we do unconsciously. If you increase fiber in your diet, because like water, many of us don't have enough fiber in our diet, but that can decrease inflammation. Eating processed foods increases inflammation. And especially if you're fighting a cancer diagnosis or something, that's your body fighting back against something that doesn't belong in your body. And processed foods make that battle so much harder and can increase your pain.
Can I add something to
Sure.
that?
Yes.
She's not just saying this. Let me explain that in your colon and your intestines, but mostly your colon, your body absorbs a lot of water. And if everything is slowed down to such an extent, more gets, I hate to say this, but putrefied in the intestines. And then you're pulling up toxins that get into your bloodstream, and everything gets caught up in your bloodstream when this is an excretory system. And if it can't work as an excretory system, it's going to pull in more toxins into your bloodstream, and it will get trapped in the areas that are injured. Not good, not good. So just by adding the fiber, like she said, it helps move things through more smoothly and gets them out more quickly. And then your body can focus on better and in a cleaner environment where you need that healing. And that's important. So it's an
Along
either
with that fiber does come, you need the extra water to help move things
right,
around too.
exactly, and maybe some turmeric or something.
We all
Yeah.
know how sluggish and tired you feel when you're not regular. It's that
Mhm.
the mystery nobody talks about. Vague symptoms, and the commercials are getting a little more obvious now. But
Yeah.
it's these are there's certain religions actually that have learned to respect all aspects of your body.
Mhm.
I was in a client's home one time years ago, and using their powder room, and eye level to the John was a prayer thanking God that their plumbing works. And in my ignorance, I thought, oh my gosh, what a stupid idea. Who sits there and prays like that while they're in the bathroom? That weekend, I had an attack of diverticulitis.
Mm.
And I just thought I have a sense of humor. I said, okay, God, you made your point,
Yep,
um,
yep.
eh,
You
but
learned firsthand what he meant.
it's, when you're constipated and things aren't moving well,
Mhm.
it affects every aspect. You're just sluggish. Your mind is foggy. It's a part of our body that we like to ignore because it's inconvenient. Sometimes we're rushing from place to place and don't always have time. We think, but nature will make time whether we think we have it or not. There is a lot of with exercise. I guess it's important to make sure you're talking to at least a physical therapist, your doctor, and make sure that exercise would not exacerbate your problem. um, but there's simple things it's not necessarily heavy exercise we're talking about. It just keep moving. If you don't, sometimes you just don't feel like it, but you got to keep one foot in front of the other. And if all you do is can get up off the chair and walk around the room a couple times an hour, that does wonders. Tells your body that you're still on the right side of the dirt.
I like that.
Well, I had
Yeah.
another patient years ago, and I'd say, George, how are you feeling today? And he would touch every part of his skin. He says, oh, I'm on the right side of the dirt. I must be okay. And I
Yeah.
never forgot that, because that's such a positive way to look at your life. There are people that aren't on the right side of the dirt, so it's um, supplements are something that people don't realize they're necessary. Our diets don't really provide all the supplements and vitamins that we should be getting. But at the same time, they are medicines of sorts in themselves. They need to be viewed like medicines because many of our modern medications that your prescriber might be giving you that you really need can have interactions with
Yeah.
what you're getting, and it doesn't mean stop your prescribed medicine, or it means have a discussion, an informed discussion, so everybody's on the same page and you can get the best benefit. Uh,
Peggy,
yeah,
would you mind, like, after the break, if I go back into the exercising thing? I want to mention a couple things.
absolutely, that would be
Thank
great. Thank you for telling me it's time for a break. Thank you.
Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant, like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
We're back with Dr. Gloria Warren, and she's going to continue the discussion of how we're going to manage our pain with exercise in this part.
Okay, I can go on and on about different things you can do, but a lot of times we mention therapies. You have massage therapy, chiropractic therapy, acupuncture, Reiki, energy healing, reflexology, different types of therapies, which is great. Complementary support, even when dealing with music therapy, aromatherapy. They distracts your mind from the pain, and these are good things. So please try them. And then we have, of course, exercise, life, movement. I get up and I move around. I lift furniture. It throws my I get my progesterone and testosterone going, and it's like the pain goes away. I love it. Everybody may have their own thing, though, but you can go do exercise therapy like Nurse Peggy said. Start with walking. There's swimming, which is low impact, and there's aerobics, which you can do even from a chair, depending on what level you're at. For your muscles, joints, or wherever your pain is, it can help get the circulation going and fill that area with fresh blood, oxygenated blood, to help heal it faster or make it feel better. Stretching, magnificent. You've seen a cat. First thing they do is stretch. And I'm sure everybody remembers, as a child, used to stretch a lot. Do you still do your stretches before you get out of bed when you first wake up? Maybe you should. Okay, so start doing those stretches again. You can check into mobility routines if you need to prevent stiffness and improve circulation. Nutrition, we've discussed that too. You want to add some nutrient-rich things such as omega-3s into your diet, which they've proven takes down swelling and inflammation to a certain degree. Inflammation means there's bacteria in that area, so you may need something else And if it doesn't take it down by itself, you may want to see a medical professional of some sort, just so that you can figure out what the heck's going on inside the tissue. Of course, excessive fats and excessive sugars and things. Hydrotherapy, excellent. Get a portable hot tub. Get in there. Get some hot water with some jets. Use it. Great for your back. It's magnificent. And there's many other complementary types of things you can do, such as Reiki, Tai Chi,
Pilates.
There you go. Yoga, just yoga stretches. Get that arch back in your back if it's your lower back. A lot of times as you get older, you slouch, so the arch goes away, and then it hits the vertebrae aren't aligned right. So you want to get all that back. And then natural medicines, I'll just do a quickie just so you know. Ginger reduces inflammation and swelling and aids muscle soreness. Turmeric and curcumin, my favorite. I take 1,500 milligrams first thing when I get up. Willow bark, which they've made aspirin out of, as we know, but it's a precursor to aspirin. But willow bark itself is more natural. And there's certain oils that also help, like lavender, peppermint, eucalyptus. There's also, in our medication today in Western medicine, there's a lot of medicine that can be considered. And Nurse Peggy is going to discuss those now.
Okay, well, it's important too when you're self-medicating with over-the-counter medications, you get confused. There's so much information out there. Non-aspirin products, for most people, can be safe. Acetaminophen, if you don't have a history of liver disease or it hasn't been specifically told by your doctor, you can't take this because of other medications you're taking. The NSAIDs, though, the naproxens, the Motrin, ibuprofens, things like that, if you're on a blood thinner, you can't take those. There's certain foods you can't eat. So green leafy vegetables, that clot your blood sooner than it should be. So those are all things to be aware of. Ask your doctor if you have certain favorite foods. Is it okay to be on this medicine? Certain medicines that you might be on, like diuretics, to help the fluid and swelling go down, they take the potassium out of your body. Potassium is a very important drug or vitamin supplement that's in your body naturally, along with calcium. It keeps your heart going right. So if there's an imbalance between your potassium and your sodium and your calcium, you're not going to be feeling real well, and you're going to need some acute medical care down the road. Anytime that you have any questions, a common Lyrica and gabapentin are two drugs that are often used for nerve pain, neuropathic pain. Most patients have told me they don't really help. But if you keep your mind open and say, I'm going to give it, along with everything else I'm doing, my dogs have been taking gabapentin for a while, the ones that were paralyzed and had nerve pain, things like that. But another thing people don't realize, regular pharmaceutical antidepressants are now used as a supplement with like the gabapentin and things like that. And when my husband passed away 8 years ago, the doctor had prescribed a low-dose antidepressant. When I saw him a few years later, for a chronic issue that I have, he says, "Why don't you take your antidepressant?" And I said, "Well, how do you know what I'm taking?" I hadn't offered that information. Well, there's a nice big computer at all the CVS's and other drugstores that they know everything that you've ever bought in the last 10 years. But he explained to me that low-dose antidepressants actually help the over-the-counter pain meds and the non-traditional, non-opioid pain meds work better when they work together. And I noticed a difference with my arthritis symptoms. And, I have Lyme disease. So when I'm swelling and having a relapse with that, there is a difference. Again, I had to prove him wrong, and I lost in that contest. But a lot of it is, there are some new drugs out there that are non-opioid that are just coming on the market. I'm not sure what the status is covered by insurance now, but your doctors, even your family doctor, is up to date on that, because they really want their your GP wants you to be happy and comfortable and functional. And a lot of them are also getting up to be the same age you are, perhaps, and they're dealing with the same symptoms. So, uh, you know, they're doing the best to help people feel comfortable,
Right.
and
Right.
you know, uh, psychological approaches. You know, therapy sometimes can help pain management, because you might be or think you're experiencing pain in a particular place. Maybe a therapist who knows your anxiety history or maybe your background a little better could identify that the pain is real to you. I'm not in any way saying it's not, but it's like your mind replaying a pain from the past. And if you
That's where
can
you can come in.
that
Hypnosis.
hypnosis and
Post
psychological therapy
hypnosis.
helps
Yes.
with that, because we have a lot of memories, especially if you had difficult childhoods, and you might be in a perfectly healthy situation, and a pain that you experienced if something bad happened to you when you were younger uh, overtakes your life if something triggers that memory.
Even a physical pain, though, it can help
It's
with.
it is a physical pain too. I
Yeah.
mean, your mind caused it to come back, and it's physical, it's real. But once you can acknowledge, okay, I know where you're coming from. I know I'm physically okay. That doctors have told me I'm healthy. I'm okay.
Hmm.
Let's see how we can get on with our life and find a better purpose for that memory. Or just
Right. Right.
acknowledge it. I needed this when I was younger, but I don't need it now that I'm older. Um,
Yeah. One area too are topical agents. This is something I think should be one of the first level pain relievers that you should try, and that would depending if it's something like rheumatoid arthritis or a sore stubbed toe or whatever. They even a sore back. They have lidocaine patches and capsaicin creams and also different gels that you may want to try. And sometimes just the mere topical sensation in the nerves can deflect your brain from focusing on the pain, and it focuses more on that. So these sometimes work, and the lidocaine, if depending on the percentage of lidocaine in the in the patch, it could actually penetrate and take care of some of the pain. But remember, these are all things that help with the pain, but may not help at what's causing the pain. So keep that in mind.
you don't want to mask the pain, because the pain is there for a reason. The
Yeah,
capsaicin patches that's an aspirin product. So if you're on a blood thinner, you'd want to talk to your doctor if that's a safe
right.
thing for you to do. Some people take a prescription medication called Voltaren. I don't know the generic name off the top of my
Oh
head.
yeah, I remember
And
that.
there's a cream for that though, which actually works
Mhm.
with less side effects than maybe putting something in your digestive system, for people, if it's appropriate with your other medications that you're on. And while we're talking about topical, I'm going to bring up the CBD products. We had a show a while
Mhm.
back from Ananda Professional, which is a pharmaceutical grade company that offers products both with and without THC. A group of pharmacists wanted to offer products for pain management and anxiety that professional people like police and nurses, doctors could take and not worry about drug testing and things like that. Um, and they're pure. I know the manufacturing standards that were met, same as you would for any other FDA regulated drug. Uh, One of my favorite products with them, I don't take it, but I rescue handicapped animals, is their bacon flavored CBD. And it's pure, there's no THC, it works.
Never in my mind did I ever think of bacon flavored CBD.
I never tasted it to see. We've got about another minute,
Yeah,
and then we're going to go into our final segment.
that was good.
Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them. Rediscover and assess their core values, philosophies, and competencies. Find settings that allow them to be the most productive and track their progress towards accomplishing goals. Did you know that your beliefs create your entire reality? But it's the subconscious beliefs that do most of the creating. Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant. Like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Hi, we've been talking about chronic pain management, and Gloria's going to be talking about Botox, which is something we neglected to mention. And I'm just briefly going to start off with that used to be a dermatological, like a
Wrinkle filler.
right. It's to fix you know,
Yeah.
like plastic surgery type, like whatever that
Right.
field is. I'm sorry,
No.
but
Okay.
and it wasn't covered by insurance if you were using it to enhance your physical appearance. Research has shown so many things. Why don't you talk about how that can help pain and some of the other things?
It's amazing. I remember years ago, like 12, 15 years ago, I always do acupressure on the nerves. If something hurts down here, sometimes I'll do acupressure up here. If you have a shot, you can do acupressure on the nerve where they're going to give the shot. You may not even feel it at all. It's phenomenal. I've shown different doctors this too, so on kids, but it led to Botox for nerve pain. So my mom was kept complaining of this pain in her face. And I mentioned it. And then the next time I went in with her, they said, yes, we're going to try Botox. And they did it in her scalp where that nerve goes. And they found the exact nerve that stopped the pain. And they injected Botox around this nerve and it put pressure on it. And because it's on the scalp and her circulation isn't that good, so it got in there and it stayed in there for like 6 months. And then after 6 months, she got a little pain, very little, but it also then went away because when she had the Botox, her muscle tension habits changed in her face. So then they weren't pressing on that nerve anymore in her jaw and in the tension areas. So she no longer had that major problem. I mean, just a few shots of Botox on that nerve. It was fantastic.
Well, I know it's often been used in Bell's palsy, which would be seen in
Yeah.
symptoms of the face sometimes.
Yeah.
For people with bladder issues, they're now using it, injecting it in your bladder because it changes the muscle tension.
Oh, wow.
And
I
it
didn't know
and
that
it
one.
it lasts
Great.
like anywhere 3 to 6 months usually. Then you have to get a refill. That type of
Mhm.
stuff is usually covered by insurance. It's not like just discretionary, your choice, voluntary type thing. And it's a medical reason, and um,
Right.
Botox
Right.
has been used for TMJ. It's been used for migraines. There's all kinds of, but again, that's not something you're going to do on your own. You do need to have a specialist do that for you.
Right. And yes, please consult with your medical professional before you go to see another professional regarding Botox, because your main professional needs to know that because it can actually have adverse effects combined with some other treatments you may be receiving. So
Any one of these alternative treatments, things like, I mean, hypnosis, acupressure. Well, if you're using acupressure in the wrong spots, you could
Mm,
cause some damage. It's
right,
important
right,
to maybe go to a professional to learn how to do it. When they come to me for hypnosis, I teach them self hypnosis, so that they can take that home and practice gets better. Teach breathing exercises. If you're less stressed out, You can practice your breathing at box breathing at a red light instead of sticking your finger out at the car that's pissing you off.
Mhm.
Just take a breath and take 2 or 3 breaths till the red light's gone. Um, and your physical, terrible, chaotic life isn't changing, but the way you're reacting to it. And that's what this is all about. You teach yourself how to react differently to the pain, to the environment that's causing the pain. But just remember, it's not just in your head. Pain has a real physiological purpose. Um,
Right.
so I recommend that you do look up Dr. Gupta's books. That those 3 are very easy to follow. The books are inexpensive. They're even in audiobooks and Kindle versions, which are even less expensive. But the information that valid, research-based, evidence-based information is out there to help. And there's hope for pain management. You don't have to live the rest of your life in pain.
The
Um,
last final thing I'll say is there are herbs out there. Be careful when you use herbs. There are negative effects of herbs too if you use too much. So make sure you see somebody reputable and that knows what they're doing. But for muscle and joint support, there's herbs for pain relief in general, nerve pain, headache relief. There's herbs even for anti-inflammatory. So that's out there for you as well. And anyways, I just thank you so much, Peggy,
uh,
for me being
Well, thank
here.
you for joining me today. This is such an
Sure.
important topic for all of us, and we're all dealing with
Mhm.
it every day. Um, and with all the other distractions we have, just remember you are in control of your health. And you can make a difference in how you feel. So thank you very much for joining us this week on The Holistic Nurse with Peggy Smith and Dr. Gloria Warren, who joined me today. We'll see you next week on Thursdays. If you like this show, please like and share it. And any questions, you can always, reach out on the YouTube page and we'll answer your questions. Everybody have a good, healthy, stress less week. That's right. We have, yeah. Just turn
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Thursdays, 1 p.m. Eastern,